In the name of Allah, the most merciful, the most beneficent. Assalamu alaikum. Welcome to the part 4 of the neck region. Dear friends, today I want to discuss the different zones of the neck. The neck is divided into 3 basic zones. To have the knowledge of different parts of the neck, the different anatomical structures located in those zones. These zones are important in case of injuries to the neck. For understanding the zones of the neck, I would have to draw again the diagram of the neck so that we can properly understand the different zones of the neck. Here, as I mentioned before, it's the root of the neck. This is the manubrium of the sternum. This is the sternum. Here, the clavicles. We make a bit more. To have a little bit clear picture of the body so that I can clearly classify the different zones of the neck. Here, this line, the zone 1 lies between 2 imaginary lines, a lower line passing just the clavicles, while the second line passes, if I draw first here, the different structures, like for example, this is the hyoid bone, this is the thyroid, cartilage, and this is the cricoid cartilage. The area lying between these 2 lines, one at the clavicles at the root of the neck or at the thoracic inlet, the other passing at the superior border of this cricoid cartilage. This is cricoid cartilage. The area of the neck lying between these 2 lines is called zone 1. The area of the neck which lies between this line, I mean the cricoid, and the angles of the mandible. Here is the angle of the mandible. This area is called zone 2. The area of the neck above this line up to the base of the skull is called zone 3. The area between the clavicles and the upper border of the cricoid cartilage is called zone 1 of the neck. The area between the cricoid cartilage and the angles of the line crossing the angles of the mandible is called zone 2, while the area above the angles of the mandible up to the base of the skull is called zone 3. Upper part of the neck is hidden by this lower part of the face. This neck, if we see from the side, this neck starts from here, from the clavicles up to the base of the skull, but that part, the upper part of the neck, is hidden by this lower part of the face. Let me first remove this. Now, for understanding the proper height of the neck, I would have to draw the diagram of the neck from the side. If I draw from the side of the neck, here there is the mandible here. While behind the mandible here, this is the base of the skull. So if you notice from the side, this area from here up to here is hidden by the lower face. So the neck is actually from the root of the neck to the base of the skull. Here from the skull, in the back of the skull, there are the muscles of the back. This is the skin, in the muscles of the back like trapezius muscle, and other supraspinal muscles. Supraspinatus muscles. Deep to these muscles from the back, there is the vertebral column. Here is the first vertebra, atlas. After that, the second vertebra, axis, and the remaining vertebrae, third, fourth, fifth, sixth, seventh. Let me shorten it up to here. So this is the 7, starting from 1, 2, 3, 4, 5, 6, 7th. The 7th cervical vertebra is identified by this longer spine. This is the vertebral column. Starting from behind, the skin, the trapezius muscle, the supraspinatus muscles, the bones of the vertebrae, intervertebral discs, now inside this vertebral column is the spinal cord. The spinal cord runs through the vertebra. For example, this is the vertebra. There is a hole inside every vertebra, and the spinal cord passes through these vertebra, which makes a column, vertebral column. And through that column, the spinal cord passes. The vertebrae, the vertebral column, the spinal cord. Deep to the spinal cord or interior to the spinal cord are pre-spinal structures, which include the muscles, pre-spinal muscles. Anterior to these muscles is the fascia. Pre-spinal fascia. Anterior to that is the mucosa. Here this whole part makes a part of the pharynx. 3 parts of the pharynx. The upper part, the nasopharynx, the middle part is the oropharynx, and the lowermost part is the hypopharynx or laryngopharynx. Now, here there is at this level, if I draw it here, the same hyoid bone will be seen from the side. It's a longer corneum, this is the lesser corneum, hyoid bone. Just below the hyoid bone is the thyroid cartilage. This is the thyroid cartilage. Below the thyroid cartilage is the cricoid cartilage. Lower to this start the tracheal rings. These are the structures from the back to the front of the neck. This part of the neck between the pre-spinal structure and this airway is the esophagus. It starts from the cricoid, below the cricoid. This part just behind the airway is called the esophagus, the food way. Now these are the structures in the neck which when viewed from the side, starting from posterior, the skin of the neck, the muscles, the trapezius muscle, the supraspinous muscle, the spinal vertebral column, the vertebrae with intervertebral discs, a hole in the vertebral column that is occupied by the spinal cord, the prevertebral muscles, the fascia, the mucosa. And just deep anterior to that is the food way, the esophagus. Anterior to that is the airway. From below, this is the trachea, this is the cricoid cartilage, and this is the thyroid cartilage, and this is the hyoid bone. Now, the area which I wanted to visualize, which was not visible from the front, is this one. This is the angle of the mandible, a line passing through the angles of both sides of the mandible, and the area above this angle up to the base of the skull. This is actually zone 3 of the neck. Now come back to the front of the neck. You know, the neck is a complex area of the body. There are different vital structures located in the neck, and the knowledge of these vital structures and their location in relation with other structures is very important for surgical point of view, as well as for traumas to the neck or injuries to the neck. Here, as I mentioned before, the hyoid bone, the thyroid cartilage, and the cricoid cartilage. Hyoid, thyroid cartilage, hyoid bone, thyroid cartilage, and cricoid cartilage. And also the tracheal rings. To make the trachea. In addition to these basic structures in the neck, there are other important structures. You know, here is the thyroid gland, a big gland lying here, starting from the thyroid cartilage up to the 2 or 3 upper tracheal rings. This is thyroid gland. This is very important structure, vital structure. It's highly vascular structure. Its hormones are needed for the body. So the knowledge of this gland is also important in the neck, in case of penetrating injuries to the neck. Behind this trachea or airway, as I mentioned before, is the esophagus. I may draw it here. Esophagus is actually lying behind the trachea and it's hidden from the front. So I draw it here as only the sides of the esophagus. Other important structures are the Arteries of the neck. There are arteries, carotid arteries. This is a common carotid artery. It divides into internal and external carotid arteries. Here, just lateral to that, is the jugular vein. The internal jugular vein bleeding, and that may cause death of the patient. But in addition to that, with each internal carotid, there is a sympathetic plexus. Sympathetic plexus. Cervical sympathetic plexus. This is an autonomic nervous plexus which is lying around the internal carotid artery. Behind these structures, as I told you before, in the side view of the diagram, there is a vertebral column, the prevertebral structures and the vertebral column. And inside the vertebral column, there is a nervous bundle that is called the spinal cord. So, any injury highly penetrated with high velocity that can reach to the vertebral column and injure the spinal cord. Now, keeping in mind the structures as I mentioned in the interior view as well as the side view of the neck, a surgeon must know the different zones and the structures located in those zones. Let me draw again the diagram. As I mentioned before, the zone 1, which lies between a line passing through the clavicles and the cricoid cartilage, upper border of the cricoid cartilage. This is zone 1. This zone is important because, as I mentioned before, there is in the center the tracheal rings, the airway, trachea. Behind the trachea is the esophagus. Just on the sides, there are carotid arteries, a common carotid, and then which divides into internal and external carotid. Carotids. Just lateral to that is the jugular venous system. Also, the vagus and the accessory nerves are lying in the neck. Vagus and accessory nerve, the 10th and 11th cranial nerves also lie in the neck. But one other important thing which lies here in this lower zone is from the thorax. That is the domes of the lungs. You know, this is trachea, which divides here into two bronchi, and there are lungs. The apex region, this area reaches this zone. So injuries to this upper poles or the apex of the lungs can also occur in the injuries in the lower zone. Now go up to from the first zone. You see from the cricoid above to the angles of the mandible, as I mentioned before, is zone 2. In this zone there is thyroid gland, thyroid gland. Behind the thyroid are the thyroid cartilage and other laryngeal cartilages. Above is hyoid bone. So these structures can be injured here. On the sides, the same vessels. Which are located on the sides of the airway and foodway. The carotids and the jugular veins can be injured in this area. Come to the zone 3, that is at the line from the angles of the mandible to the base of the skull. Again, there is the oropharynx, the vertebral arteries which lie on the sides of each vertebra. They pass through the holes on the sides of the vertebral column. So those vertebral arteries and the spinal cord can be injured in this zone 3. In addition to these structures, as the upper limit is the base of the skull, so the base of the skull can also be penetrated in these injuries. Now, why these zones are important for a surgeon to know? The fact is that the surgeon knows the different structures which are located in the different zones of the neck in case of penetrating injuries. Now, what we have to do when a case with a neck injury comes, the first thing is that to first classify in which zone this injury has occurred. Let me draw again the diagram. For example, there is a stab wound with a knife. Here. This is a stab wound. Let me penetrate this like this. It's a wound from the side of the neck. The first thing is to classify this area. We have to palpate the cricoid cartilage. If this wound is above the cricoid cartilage, this is in zone 2. If this is below the cricoid cartilage, this is in the zone 1. So this sort of wound, the wound at this area will be counted in the zone 1. So every zone has different management plans. In some cases, we have to take prompt actions to explore that area, while in some cases we don't need to take prompt actions, just to wait for some other conservative management and to wait for any deterioration of the case. If the injury is in this area, then this is the zone 2. If the injury is deep to that area, it is the zone 3. Now, the question is how to manage it. The management has no doubt difference in the injuries in the different zones, but the general principle is that to first stabilize the patient. The rule is the same: to maintain the airway, stop the bleeding if there is active bleeding, maintain vitals like blood pressure, and if there is hypovolemic shock because of excessive bleeding. And one more important thing, in case of blunt injuries to the neck, like in road traffic accidents, there is injury to the vertebral column. So the care of the neck is very important, particularly if the patient is drowsy or unconscious, or there is other neurological symptoms. So in that case, we would have to take care of the neck, properly put a collar around the neck, and or handle the patient very gently, so that the neck must not be handled aggressively. But if there is an open wound in the neck, in that case we cannot cover that neck with a collar, because injuries are hidden and we cannot assess whether there is expanding hematoma or other respiratory distress. We should also notice for bubbling from the wound. That means there is perforation in the airway. So different signs of neck injuries and the complications of that injuries are usually visible in the patient, like bruise in the neck, visible wound in the neck, there is swelling in the neck, blowing of air from the wound. So in all these cases, we can assess the extent of the injuries. But one important thing we should have to know, that the penetrating injury is that injury which has crossed the platysma. Platysma muscle is a thin muscle in front of the neck, and that muscle is a reference standard for the extent of the injury. And that muscle, if I draw it here, for example, this is the side of the neck. The first muscle which comes behind the subcutaneous tissue, there is a muscle that is called the platysma muscle. Platysma. If I draw it here, it will be located here like this. This is the platysma muscle. It's a thin layer of muscle which lies just deep to the subcutaneous tissues and covers all the structures in front of the neck. So we take this muscle as a reference standard for the intensity of the injury. Any injury which crosses this platysma muscle is called a penetrating injury. We cannot call this injury a penetrating which does not cross this muscle. This is penetrating injury. So if the patient is otherwise fine and there is a wound in the neck, we should explore that wound under local anesthesia, so that we can know whether this wound has crossed this platysma or it's superficial to the platysma muscle. If it's superficial to the platysma muscle, there is no need for exploration, there is no need to worry that it's not a penetrating wound, rather it's a superficial wound. So this was all about the different zones of the neck and the injuries to the different zones of the neck and the important structures located in these different zones of the neck. Thank you.